Hi there, Dr. Shelby here at Evolve Chiropractic in Woodstock. I'm going to show you a couple tips and tricks on how to use a massage gun in both the hamstrings and the calf. I've got Dr. Allen here with me to help out and be a demonstration model. So I'm going to have him go ahead and lie face down. Now, do you have to have your person lying down to do this? Absolutely not, but this can be more comfortable for people. It can also be more comfortable too if they do have a lot of low back issues, to use a bolster cushion or a pillow to prop the legs up a little bit. That's going to take some pressure off the lower back, and then it can also take some slack out of the, take some slack out, put some slack into the muscles that you're working, so both the hamstring and the calf, and it can make it more comfortable for your person or patient. So like I said, we're gonna be working a few different areas. We're gonna start in the hamstring. So a lot of people know that your hamstrings are the back part of your thigh. What most people don't know, that this is a dense muscle belly of tissue. You've got three different types of muscle in the hamstring area here. So you first have your semitendinosus. It's more on the inside of your hamstring. You have your biceps femoris longus, that's more on the outside. And then you have your semimembranosus. It's actually bigger and broader, but it's underneath your semitendinosus, kind of spanning across the middle and inner portion of the back part of the thigh there. So that's why I said it is a deep, dense tissue belly here of muscle. So while we're doing the, while we're using the massage gun, I always like to start with a more broad or rounder circle head. You can always go into something a little bit more flat the more you're working into that tissue area, but I find that for scanning purposes, using a bigger, broader head is going to be better. So when we're looking to use these massage guns, I always like to start on a higher setting to do a scanning pass through that area. So when I'm saying that, I'm going about level 4 through 6 on the massage gun here. And when I'm working this area, I'm going to be going from kind of right about the end of the butt there, right where your sit bone is, down to the back part of the knee. Because as you can see, that a lot of those muscles go from that area underneath the butt there down to the back part of the knee. So when we're using the massage gun, we don't want to be pressing too much into the area. The more you press down, the more uncomfortable it can be for your person that you're utilizing the massage gun on. So I always like to let the gun do its work for me. So I'm just using a little bit of pressure. Now, this area can be highly sensitive as well. Even though it is a dense, deep tissue belly there, we want to make sure that we're not using a whole lot of pressure that can create a lot of pain and discomfort. So as I'm starting out, I'm starting on the outside, kind of near where that biceps femoris muscle is here. And I'm just kind of running the massage gun up and down. How's that pressure feeling for you, Doc? Good. You always want to start with asking the person that you're using the massage gun on how that pressure is feeling. You don't want it to feel super painful where they're starting to tear up and cry on your table. That does not do well for you. It does not do well for them. So you want to make sure that this is creating a little bit of pressure but not becoming uncomfortable. So now I'm going to start getting into more of that semimembranosus muscle belly here, kind of right in the middle. Again, I'm just doing a few scanning passes. Big thing you want to remember is you don't want to be going into the back part of the knee. You have a lot of muscles, nerves, arteries, veins back into that knee there, and that can get very tender, sensitive, and if you start trying to use the massage gun in that area, they can start getting tingling, numbness down into their feet, which you don't want any of that. Now I'm going to start moving the massage gun into more of that semitendinosus area here. Again, checking how's that pressure for you. Good. So when I find an area, I can tell right about there, it's getting a little twitchy, a little bit tense on me here. I can see his foot kind of moving. First thing you want to notice is if you are noticing a lot of twitching, that can be a trigger point, that can be a pretty sensitive area. So you want to back off pressure a little bit. How is that? Is that a little sensitive right there?
A little bit.
Yep.
Yeah.
So you can take and do small circles in that area there. You don't want to spend too long on it, but you want to spend enough time. So I say anywhere from about 15 to 30 seconds working in that area and then coming off of it, allowing that trigger point to rest a little bit. And again, just finishing up with my scanning passes. Always want to make sure you're working on both sides. So again, I'm finding where his hamstring is, so kind of right up where that sit bone is, down to just above the back part of the knee here. I'm going to be working that biceps femoris muscle on the outside of the leg. Again, letting the massage gun do most of the work for me, not pressing in too hard. Starting to work more into that semimembranosus area. Again, going as close to the back part of the knee as I can without actually going on it. I always find it helpful to take your extra hand, placing it right where you want that boundary to be, because once you hit that hand, you know that you have to get working back up. And we're gonna shift over into the semitendinosus muscle. Now from here, we can start working into more of the calf muscle. So with our calf muscle, so with our calf muscle here, let me zoom out. We have essentially two muscles with three muscle heads going on here. So you have your soleus muscle, that's a deep muscle underneath your calf muscle. Let me make sure, perfect. So your soleus muscle is a deep muscle underneath your gastrocnemius muscle. Your gastrocnemius muscle has two heads. You have the medial head, which is on the more inside part of your calf, and then the lateral head, which is more on the outside. So all three of those muscle bellies come together to make up your Achilles tendon, which goes right down into your foot. So if you've ever heard anybody talk about having Achilles tendon pain, Achilles tendonitis, even plantar fasciitis and foot pain, that can all be related to tight calf muscles. So this is really great if you are on your feet all day, you're walking a lot, you're doing a lot of activity outside or in the gym. This is really great and can be really beneficial for those people. Again, this can be a very sensitive area as well. So making sure that you're letting the massage gun do all the work for you. You're not pushing too hard into the area. So again, I'm going to start with my scanning pass. I'm going up to about a level 5 here. I'm going to be working at the bottom part of the back of the knee. So again, the back of the knee has a lot of arteries, nerves, and veins. We don't want to be using the massage gun in that area. So I'm going to be placing my free hand right where the back part of that knee is, and I'm going to be starting to work more on the outside, so the lateral head of the gastrocnemius. Kind of going all the way down, and you can go all the way almost to the back part of that ankle there where that Achilles tendon comes in. A lot of people, again, it can be very sensitive, so making sure you're not holding too much pressure, but it can help loosen that area up just a little bit and create a little bit of relief, especially if you have people who have pain into their calf muscle or into their feet. So again, I'm just starting with a scanning pass. Up and down here. How's that pressure, Doc?
Good.
Good. And I'm going to kind of go right in the middle there.